overpopulation, urbanization, climate change, and geopolitical conflicts that continue to disrupt supply chains. According to the Food and Agricultural Organization, or FAO 2023, around 2.4 billion people worldwide face moderate to severe food insecurity, with 783 million people suffering from chronic hunger. These challenges are worsened by armed conflict, rising food prices, and the long-term effect of COVID-19 pandemic that have weakened food system in many countries. Despite ongoing global efforts to achieve Sustainable Development Goals, or SDGs number 2, zero hunger, the slow progress in reducing undernutrition shows that many countries are still far from building fair and resilient food systems. In Indonesia, food security challenges are linked to the country's wide and diverse geography, which leads to unequal distribution of food. Data from Statistik Indonesia, or Badan Pusat Statistik Indonesia 2023 shows that although Indonesia has a national surplus in rice production, the distribution is not balanced across regions. Around 20% districts and cities are still depends on the food supplies from other areas because they cannot meet their own needs. These inequalities is also reflected in nutritional status. The 2018 Basic Health Research, or Riset Kesehatan Dasar Indonesia, report a national stunting rate of 30.8%, which higher rates found in eastern Indonesia.
The disparities is even more pronounced in affected regions, underdeveloped, frontier, and autonomous areas, such as East Nusa Tenggara, Papua, and Maluku. These areas face ongoing limitation in transportation, technology, food storage, infrastructure, and even access to health and education. BPS data shows that Nusa Tenggara Timur is the province with the highest rate of food insecurity, with 14.68% of its population affected. This significantly exceeding the national average of 4.5%. However, to this day, the fundamental infrastructure gaps continue to hinder the equitable food distribution, especially on the remote areas that have zero access to technology and information.
Despite ambitious ASEAN initiatives and national policies to strengthen the food systems, undernourishment still remains stubbornly high. Across Southeast Asia, approximately 8.1% of the population still remains undernourished. Indonesia, home to more than 270 million people, no exception. Roughly 1 in 5 of its districts still fail to meet food self-sufficiency targets, forcing costly inter-island imports and emergency aid to fill the void. Herein lies a striking irony. While Jakarta pours resources into flagship programs, in Nusa Tenggara Timur, seasonal drought routinely disrupts harvests, yet policy frameworks still lack the ability to forecast which districts will face its problems next. As a result, high malnutrition persists. Around 37.9% of children under 5 and 10 are stunted, nearly twice as the national average of 21.6%. Secondly, food aid arrives late. Relief operations will only mobilize after the field surveys confirm acute scarcity, which increases the logistic cost of nearly 50% and leaving families without sufficient food for weeks. Lastly, post-harvest losses soar. Nearly 19% of staple cereal spoiled before reaching the market because storage and transport projects were planned without predictive and real-time data.
In essence, the mismatch between top-down policies and on-the-ground realities leaves ASEAN, Indonesia, especially NTT, perpetually reacting instead of preventing food crisis. Without a predictive data-driven approach that aligns resources with real-time local needs, the cycle of undernourishment and unwanted investment will continue unabated. This raises a question among us. How can Indonesia shift from a reactive food aid interventions to a proactive, data-driven food security strategy that ensures an equitable access across its archipelago, especially in 3T areas that needs more attention and faces bigger problems?
In an effort to address hunger and food insecurity in 3T areas, an innovation approach based on AI-powered participatory rural appraisal is a promising strategy. This concept combines the collecting data from local community with the power of AI technology to identify the root causes of food security problems in more in-depth, contextualized, and evidence-based manner. By understanding local conditions directly from local communities such such as food availability, food diversity, commodity prices, climate change, and nutrition complaints, the system enables the constructive operative models based on clustering algorithms that can predict an optimal food basket or the local food composition. These results can be visualized to show changes in food trends and to help promote the independence of the local food sector in a sustainable manner. This process not only produces suitable food solutions, but also strengthens the key dimensions of food security, such as availability, access, utilization, and stability. First, at the availability aspect, AI can finish purpose and production so that potential hunger can be prevented early on. Second, on access dimension, AI can detect price spikes and food shortages, enabling interventions to maintain stable nutrition consumption. Third, on the utilization aspect, AI is used to develop personalized nutrition guidance based on community needs. Fourth, on the stability aspects, AI can predict food insecurity seasons and design systems for vulnerable ages, such as toddler and elder.
This initiative contributes to global health advocacy to more equitable and data integration. By adopting a decolonized approach from food and health data, this information collected from communities is utilized not merely as the object of analysis, but also as the tool to strengthen the community's own capacity to understand and effectively utilize the food local conditions.
This model supports sustainable rural development by empowering local private systems such as villages, farmer groups, and health community centers with more equitable technologies. Moreover, our innovations enabling a social determinants approach towards a more relevant and just method across regions. To support this program, we propose the budget allocations of $500,000 over 3 years. The funds will be allocated to the development of AI systems, training for facilitators and healthcare workers, implementations in 3 areas vulnerable to food insecurity and stunting, the integration of AI and dashboard systems, monitoring and evaluations, as well as evaluations and advocacy. The remaining funds will be allocated to support the technical and communities management to ensure the sustainability of our programs.